Assalamu alaikum everyone. I'm Dr. Naushad Bandali, and as part of our health series under care space and community health, today I'd like to talk to you about asthma. Specifically, some of the common things that help people living with asthma manage their condition more effectively. My goal today is to keep this practical and easy to remember so that whether you're a patient, the parent of a patient, a caregiver, a friend to someone with asthma, or just someone wanting to learn more, you'll walk away today with some useful information. So, what is asthma? Asthma is a chronic condition that affects the airways of our lungs. These airways become inflamed and sensitive quite easily, and when exposed to certain triggers, they tend to narrow and produce extra mucus, making it harder to breathe. Typical symptoms include coughing, wheezing, shortness of breath, and of course, chest tightness. So, how does someone get asthma? People can get asthma from a combination of factors. They can be genetic, environmental, that can lead to chronic inflammation and swelling of the airways. A strong family history of asthma or allergies, a history of childhood respiratory infections, low birth weight, and exposure to irritants like cigarette smoke, air pollution are all major risk factors. Asthma affects different people differently. Some individuals might only have mild, occasional symptoms, while others may experience more frequent or severe episodes. The good news is that with the right strategies, the right treatment plan, most people with asthma can live their lives actively and normally. So, what are the key things that really makes a difference for someone with asthma? Let's go through these step by step. Number one is knowing and avoiding triggers. Asthma symptoms are often set off by specific triggers, and these can vary from person to person. Common triggers include dust, pollen, smoke, strong perfume, exercises, cold air, chilled and fizzy drinks, and even stress. Identifying these triggers and taking steps to avoid them and reduce exposure to them is a cornerstone of asthma control. Number two, taking medications correctly. Asthma medications fall into two main categories. We have our relievers and our preventers. Our reliever inhalers, often called as rescue inhalers, work quickly to relax the muscles around the airways, and these are used when symptoms like acute coughing and difficulty breathing occurs. Examples include inhaled salbutamol, and if symptoms still persist and become more severe, then nebulizations and even intravenous steroids may be required. Preventive medications, on the other hand, these are usually taken every day, even when you feel all right and all well. They help reduce inflammation and swelling in your airways and keep symptoms from developing in the first place. Examples of these include Montelukast tablets, inhaled corticosteroids like budesonide and fluticasone, and other combinations like Foracort inhalers, which I personally prefer prescribing most of my patients. One of the most important things I tell my patients is this, that don't skip your preventer inhaler just because you're feeling all well and fine. It's silently working in the background to keep your airways calm. Number three, we have inhaler technique. It may surprise you, but studies show that many people actually don't use their inhalers correctly, and this reduces how much medication actually reaches the lungs. It is always worthwhile asking your healthcare provider to review your technique even though you think you mastered it. Small adjustments can make a huge difference. Number four, lifestyle and overall health. Simple lifestyle changes can greatly support asthma management. Regular physical activity, when done safely, strengthens the lungs, maintaining a healthy lifestyle. Also, maintaining a good weight often helps reduce the burden on the lungs, therefore making it easy to breathe. And most importantly is not smoking, which is absolutely essential. Smoking worsens asthma and makes medication less effective. It is also important to note that exposure to secondhand smoke should also be avoided. Number five is vaccinations. Because respiratory infections like flu and cold can trigger asthma attacks, and keeping up to date with recommended vaccinations is another protective step. Now, I'd like to talk about one of the most powerful tools in managing asthma, and that is the Asthma Action Plan. The Asthma Action Plan is a personalized written guide that you create together with your doctor or healthcare provider. It outlines what medications to take daily, how to recognize when your asthma is getting worse, and even in an emergency. Usually, it's color coded into 3 zones for easy references. We have your green zone. This is when you're feeling well, no symptoms, you're breathing normally. Here, you continue to take your regular preventer medication and avoiding your triggers. The yellow zone, this means the warning signs are showing up, maybe coughing more at night, using your reliever inhaler more often than not, and feeling short of breath. The plan will tell you what extra steps to take and what other medications to consider. Red zone, this is when symptoms are severe, like you're struggling to speak in full sentences, you're using your inhaler without much effect, or you're just feeling extremely breathless. In this zone, the plan will direct you to seek urgent medical help immediately. The beauty of an asthma action plan is that it takes away any uncertainty. Instead of wondering, should I go to the hospital or not, you have a clear written guideline for you to follow. It empowers patients and it reassures the families and caregivers. So, let's recap the key things that help an asthmatic. 1 is identifying and avoiding triggers. Number 2, taking medications as prescribed, both relievers and preventers. Number 3, using the correct inhaler technique. Number 4, supporting overall health with lifestyle changes and vaccination. Number 5, and very importantly, having a personalized asthma action plan. Asthma does not have to control your life. With awareness, consistency, and the right tools, you can take control of your life and your asthma and continue doing the things you love. If you have asthma, I encourage you to talk to your healthcare provider about reviewing your inhaler technique, updating your vaccinations, creating or revising your asthma action plan. If you're a parent or a caregiver of someone with asthma, make sure you're familiar with the action plan as well, as it can be life-saving. Thank you for listening. I'm Dr. Naushad Bandali, and I hope this talk has helped you understand asthma, why do people have it, and given you practical step-by-step approach to make asthma management effective and easier to manage.